Hello, I'm Esther Gidhu-Ewart. Welcome to Africa 54. Here's what's coming up. The World Health Organization declares Mpox a global public health emergency for the second time in 2 years. Republican and Democratic presidential candidates woo voters in U.S. Midwestern states viewed as critical to their campaigns. And in Uganda, a community of breastfeeding women is helping mothers who are struggling to feed their newborn babies. All this and much more coming up on today's Africa 54. The World Health Organization has declared Mpox a global public health emergency for the second time in 2 years. The WHO says, quote, the situation constitutes a public health emergency of international concern. Viewers Philip Alexiou has the latest.
The alert comes after an outbreak of the viral infection in the Democratic Republic of Congo spread to neighboring countries. WHO Director Tedros Adhanom Ghebreyesus.
The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Mpox, which is usually mild, can spread through close contact and in rare cases be fatal. It causes flu-like symptoms and pus-filled lesions on the body. The outbreak in the Congo began with the spread of an endemic strain known as Clade 1, but a new variant, Clade 1b, appears to spread more easily through routine close contact, including sexual contact. It has spread from Congo to neighboring countries, including Burundi, Kenya, Rwanda, and Uganda, triggering the action from the WHO. Tedros said on Wednesday that the WHO had released $1.5 million in contingency funds and plans to release more in the coming days. WHO's response plan would require an initial $15 million, and the agency plans to appeal to donors for funding. Philip Alexiou, VOA News.
For more on Mpox, joining us now is Africa 54 health correspondent Lino Mudu with more on this health emergency. Hello, Lino.
Hello, Esther. This latest outbreak of Mpox is a major concern. For more insight, I spoke with Dr. Sam Boland. He is the acting incident manager at the WHO Regional Office for Africa.
The response to Mpox in the African region has already very much been ongoing. So both in countries that are actively affected as well as in countries that are at risk, the World Health Organization has been working with ministries of health and member states as well as coordinating partners to be sure that we're already actively responding to this particular problem. The declaration of a public health emergency of international concern that was made by Director General Tedros earlier this evening really serves as a call to action to the global community, which can have a lot of positive consequences for our ability to effectively respond to the crisis at hand. So in addition to all of the work that was already ongoing, what this means is that we can work with the international community to make sure that we have the resources available to respond. But in addition to that, it means that, as we are already doing, we can work under what are called the international health regulations within the emergency response framework to really make sure that we're effectively coordinating the response. So we're going to be doubling down on our efforts, bringing in those additional resources, and making sure that we can bolster the work that we're already doing.
What are the recommendations to address an Mpox in general, particularly this new form of Mpox that seems more virulent?
There actually is a treatment available, tecovirimat, and the World Health Organization has been supporting countries in the African region, for example, South Africa, to be sure that they're able to access doses of this very novel therapeutic to be sure that people are able to get the clinical care that they need. And this is a very difficult process, and it's the same process that is true for vaccination, which is that really one of the barriers is a regulatory one. We have to work country by country to be sure that countries are able to import and then put to use something like the therapeutic that's available, or in the future, the vaccinations that we may be able to roll out. We have worked with, for example, the Democratic Republic of the Congo with their national regulatory authorities and their Ministry of Health to be able to bring vaccines and to come up with a vaccination plan that hopefully in quite the near future, in the coming weeks or a couple of months, they'll be able to begin targeted vaccinations within the country. Dr. Tedros last week, independent of the PHEIC declaration, initiated what's called an emergency use listing procedure for 2 different Mpox vaccines. That process will take a little bit of time, but once it is concluded, provided that the vaccines are assessed to be viable, there will then be the opportunity to really more significantly roll out vaccines to interested countries. And so what we'll be doing in the meantime is working with risk communication, community engagement, and also that regulatory component that I've already discussed, to be sure that once vaccines do become accessible, that we're in a position to hit the ground running and roll them out to the people that need them.
Speaking of contact tracing, do we have a clear understanding as to who patient 0 is, where it's coming from, and also the way by which the outbreak is spreading across borders?
With Mpox, that's not something that we are able to identify for most of the outbreak that we're focusing on at the moment. This is because Mpox has really been endemic for quite a long time in parts of Africa, especially in Central Africa and also in West Africa. Sometimes, depending on the country or specific outbreak we're talking about, it is possible to identify a patient from whom we think the first case was communicated from what we call the animal reservoir. In the case of the outbreak in the Democratic Republic of the Congo at this moment in time, however, really we're talking about cases that are being communicated between one person and another person. And so at this point, the concern is really about making sure that we can provide those people the support and the prevention as well, and the risk communication and community engagement they need to try to prevent that transmission from continuing. As the WHO ourselves, and under the international health regulations and our emergency response framework, we work very, very hard to be sure that we're in a position to support coordination between all partners, including the Africa CDC, but also including other UN agencies such as UNICEF and other INGOs and the like, to be able to ensure there's a harmonized, synergistic, and coherent response, coordinated response to this particular crisis at hand.
That was Dr. Sam Boland, acting incident manager at the WHO Office for Africa. Esther?
Thanks, Lino. We appreciate your reporting. Lino Mudu is the Africa54 health correspondent. Mental health illness is rising among women in Zambia. It is now a leading cause of suicide. VOA's Daniel Tonga reports from Lusaka.
Increasing incidents of suicide among women in Zambia have become a major concern for health providers in the country, such as Dr. Francisca Walia, a psychologist at the Chainama Hills Mental Hospital, who sees the rise in female suicides linked to untreated mental health disorders.
Suicide has a mental health aspect to it, because when we talk about our mental well-being, it looks at the areas of how someone thinks, how they act, right, and how they feel. So when we talk of someone who's presented with suicidal ideations, one thing that we appreciate is that the type of thoughts that they're having are definitely not positive, they're quite negative. Then how are they feeling at that point? They're definitely not having any positive feelings. They're hopeless, they feel like giving up.
Dr. Edwin Mumba, one of the most vocal advocates for mental health, states that psychosocial problems often lead women to perceive themselves as failures in life. This sense of failure creates mental problems, fostering feelings of hopelessness that culminate in suicide.
Psychosocial problems are the ones that are driving women to commit suicide. So it could be a social pressure. You find that maybe at a certain age, your friends or your peers have attained certain things. Could be marriage, could be houses, could be having children as well. So you find that a person who's not having those things might think as if they're actually failure in life, and they might try to take their own life.
According to Zambia's Chainama Hills Mental Hospital, the facility receives and treats an average of 16,200 mental health cases each year. One of these cases is in Chimunya Muleya, a woman who attempted to take her own life and attributes her suicidal ideation to her mental illness.
Well, I was diagnosed with psychotic depression, so that means I see things that are not there. When I don't take my medicine, I take antipsychotics, which is called risperidone. So if I don't take that medicine, I'm going to see things that are not there. I have auditory and visual hallucinations. So when those things are going on, it's like people are having conversations in my head telling me like, okay, you're not worth it. You just end your life. You know, your parents can have another kid. It's not like it's the end of the world for them. You know, the world will still go on even if you end it right now. So that's what's going on in my head. And fighting those thoughts is really hard unless I take the medicine that silences the voices, or I self-harm. That will make me feel better.
Dr. Yasmin Muchindu, psychologist at the University of Lusaka, believes the solution to mental illness and suicide in women lies in taking care of their mental health needs.
Suicide is a global problem, not just amongst women, but men too. And the way we can prevent it is by according it the importance it deserves in the lives of modern individuals, male or female, and more especially females. It's by actually paying attention to mental health needs of a woman.
Mr. Kennedy Mtale, psychologist at Decisive Minds, agrees.
We are human beings and we are social animals. So one of the most important things is human beings, they need to seek support. So whenever there is a challenge, in case someone has a problem, the first support should come from the family. The family is a very important system that will be able to help women. But apart from that, we also need to empower women. We empower women, economic empowerment.
Mental health experts say mental illness is a growing health crisis, with the biggest challenge being avoidance, stigma, and lack of right policies to deal with it. They suggest raising awareness about mental illness will help reduce rates of suicide by death in women. Daniel Tonga, VOA News, Lusaka.
Wisconsin is one of 3 states in the Midwest both Republicans and Democrats view as critical to their presidential campaigns. VOA's Ken Faribault has more.
When VOA met Wisconsin restaurant owner Gonzalo Perez in 2017, he expected a big boost in business.
It's my lottery ticket.
That's because Taiwanese company Foxconn planned to build a massive flat-screen manufacturing facility not far away. Employing as many as 13,000 workers, Perez thought might frequent his restaurant. But Perez's dreams and Foxconn's plans didn't meet reality. Today, Foxconn's scaled-back southern Wisconsin facility employs fewer than 1,000 people.
The promise never was done.
Instead of a busy restaurant filled with customers, Perez is dealing with empty tables, staff shortages, and rising costs due to inflation.
The economy is really bad for us.
I think that the real key when people go to vote in many cases is how do I deal with rising costs?
Bob Whitkey is a Republican representative in Wisconsin's State Assembly, whose current district is near both Perez's restaurant and the Foxconn facility. While the economy is a top issue for voters, he hears even more frustration with what they see as a lack of bipartisan cooperation among lawmakers.
That we don't work together. I hear from both parties. You're not getting anything done.
Nick Ramos is the executive director of the Wisconsin Democracy Campaign, which he says is a bipartisan organization dedicated to good government in Wisconsin. The organization recently participated in a successful effort to change state legislative district maps in Wisconsin. Voters he talks to express concern about the future of U.S. democracy.
My hope is that no matter who ends up taking the Oval Office, it will be somebody that actually engages the people and actually wants to try and do everything to not only safeguard democracy, but find ways to make it better.
Wisconsin is a state as divided as any in the country, but what both Democrats and Republicans here can agree on is that succeeding in the presidential election in this state in November depends on how well they can get their voters to turn out.
So, Wisconsin, today I ask you, are you ready to get to work?
Recent polling in Wisconsin indicates Democratic nominee Vice President Kamala Harris has a narrow lead over Republican nominee former President Donald Trump.
A vote for Trump is a vote to save Wisconsin, and it's a vote to save your country.
Restaurant owner Gonzalo Perez hasn't attended political events and hasn't met either candidate.
Lifestyle never change. It don't matter who gets it. I got to keep working 7 days a week, same schedule. I pay taxes regular. I don't see no benefit.
Perez says one thing above all will determine how he'll make his decision.
Sometimes I vote for whoever I think is going to be a change.
Kane Fairbaugh, VOA News, Madison, Wisconsin.
Botswana has welcomed home Letsile Tebogo, 21, winner of the Southern Africa's country's first ever Olympic gold medal. Tebogo became the first African to win the men's 200 meters in an African record time of 19 minutes 46 seconds. Families with children, elderly people and young supporters waved Botswana's sky blue, white and black national flag as the Olympic team landed in Gaborone Tuesday. Hundreds of supporters gathered at the small airport to celebrate Tebogo's success. Botswana captured 4 medals in the Paris Olympics. Reporter Mkondisi Dube spoke to people on the streets of Gaborone about Botswana's Olympic performance.
And I'm here at the airport to come and welcome our boys back from Paris and the Olympics. And I must say today is a proud day to be a Motswana and very exciting. And I'm excited to be here.
I'm very proud. I feel very big because this is our first gold medal. I don't know what to say. I just feel big. I just feel proud. I just feel proud because this is what can I say? It's a history. It's a history that will never be forgotten.
I feel so overwhelmed about the entrance. We are waiting for Letsile Tebogo and we are so happy, guys. Yeah. It has been an honor and a very exciting moment to welcome our very own Letsile Tebogo from the Paris Olympics. Thank you.
I'm here to support Team Botswana, all in relay team, 100 meters, 200 meters, and not forgetting all Team Botswana coaches. We are proud of you for all what you did.
Botswana made it into the history books by winning the gold medal in the 200 meters by Letsile Tebogo. So we are here, we are excited. The mood is high, everyone is happy. I'm so happy. It's a very beautiful time to be alive in Botswana.
Botswana's success at the Paris Olympics helped to raise Africa's medal haul to 39, 2 more than at the Tokyo Games, with Kenya winning 11 in medals. Still to come, a Ugandan community of breastfeeding women help mothers struggling to feed their newborn babies. We'll be right back.
It has been said that art is the windows to man's soul. Without it, he would never be able to see beyond his immediate world, nor could the world see the man within. On the next Our Voices, we'll explore the benefits of art therapy with an emphasis on the mental health advantages, as well as how it can address culture, gender diversity, and social justice issues. Join the conversation each week right here on Our Voices.
In other news, Ugandan officials say the death toll from last Saturday's landslide at a massive garbage dump in Kampala has risen to at least 26 people, with at least 39 people still missing. Among the missing are 35 local residents and 4 garbage collectors, and more bodies could be found, according to authorities. France commemorated the 80th anniversary of the Allied invasion of the French Riviera in World War II to push back the Nazis. The ceremonies attracted special attention to the many African soldiers sent from then French colonies to participate. And U.S. and Botswanan military personnel wrapped up a 3-day workshop Thursday in Gaborone, Botswana, focused on better integrating women into the African country's army. The workshop addressed issues such as sexual harassment and the need for tailored equipment. A community of breastfeeding women in Uganda is helping mothers who are struggling not to just feed their newborn babies, but to keep them alive. Halima Thumani and Mukasa Francis report from Kampala.
In March, complications with Mbabazi Resti's pregnancy led doctors to perform an emergency cesarean section and deliver her child at 36 weeks, about a month early. Resti then suffered a cardiac arrest and was placed on life support. During recovery, she could not breastfeed her baby, and so the hospital was substituting formula.
He was given powdered milk, but unfortunately, he faced a condition called NEC stage 1, whereby he wouldn't digest the powdered milk well.
Resti reached out to the Atta breast milk community, and the baby started getting breast milk from a donor. Rachel Akujiziwe is the administrator at Atta breast milk community. She says the organization was started in 2021 by a mother whose recently born child passed away.
Because she had a supply, she asked the doctors, where do I put the milk? They told her, all we can do for you is to give you tablets to dry it up. She said, but you see, I needed it. I mean, there should be a mother or so, a baby who needs the breast milk.
The breast milk is for mothers who have babies between 0 to 6 months old, but it's not easy to become a donor. Akujiziwe says donating mothers can't be on drugs and must undergo blood tests.
The blood work that we do, we check for HIV, we check for hepatitis, we check for syphilis, we check for CMV. They are screened before they start donating, this milk.
Sadia Hussein Mulangwa is a mother of 2 and found her body was producing more milk than her babies needed. That is how she learned about the breast milk community and says she is a committed donor.
The fulfillment that I will get from this, knowing that I'm saving a life somewhere or giving better health or just a better living to a helpless child. I'm like, what bigger sadaka is there than that, really?
The Atta breast milk community says they have helped over 500 babies over the past 3 years, providing 800 liters of milk from close to 150 donors. Halima Othmani, VOA News, Kampala, Uganda.
Cameroonian visual artist Shiri Achu uses several mediums, including oils, acrylics, watercolor, and mixed media to capture the spirit of her subjects, from natural moments captured in Africa to still objects. For a closer look at Achu's work, let's go live here in Washington to VOA's Jackson Vunganyi, who has more news on Shiri Achu and her print series, which promotes African lifestyle and culture. Hello, Jackson.
Hi, Esther. Good afternoon. Good evening to our listeners around the world. We're here in Washington, D.C., downtown D.C. Now, for us who are in the campaign season, it's very easy to overlook the fact that Washington, D.C. has one of the highest number of collections of museums around the world. And in those museums or such venues like this, you find exhibits or exhibitions by artists from around the world, including our very own from Africa. And we're here with the colorful Shiri Achu from Cameroon. Shiri has been painting since she was 9 years old, and for this month she's been exhibiting here at the Venn Hotel. Shiri, tell us about your exhibit this year.
Well, thank you so much for having me here. This is my 10th anniversary exhibition. So every year I go to a new city and I exhibit because I want to portray and showcase Africa culture through my work. You know, from 35 was London, then DC, then Australia, Jamaica, Toronto. Every year I make it a point to go to a new city and exhibit, because that is what I love to do, just showcase and promote Africa culture through my work.
Right, and this one is
this year is Washington, D.C., and it's my 10th one.
Okay.
Yeah.
So what kind of themes do you paint about? So what are we looking at here in the background, for example?
I love the everyday life in Africa. There's a simplicity and a beauty. You know, a girl, it's not a boy. This is a girl. Girls do this too. Climbing a tree, getting the pawpaw. This tells the story of, you know, beginning, struggling, and of course getting to your victory. Everyday life. You're going to the market. You know, when you're carrying your child, women carrying their children to the market.
Beautiful art.
Yes.
Yeah. And you call it 45 in print. What does that mean?
It means within this exhibition we have 45 pieces.
Okay.
So every year when I move to the next, I add an extra piece.
Okay.
Yes.
And you say some of the proceeds from this exhibit is actually going to a good cause. Talk to us about that.
Yes. So in my village in Cameroon, there's a school which needs. 7 years ago, we raised some money to complete the Raise the Roof campaign to complete the roof. This year, when I went, I saw that it was completed. I was very excited. But then they said, well, we need more to complete the floor of this school.
Right.
So 10% of every sale from this exhibition is going towards that. And of course, every gift, 45% goes to the cause as well.
Right.
Yeah.
Esther, back to you in the studio. We're still here enjoying the art. Shiri and I did not really talk about our hat matches, but as you can see, it is part of the artwork. Thank you so much,
Jackson,
Shiri and Esther.
Jackson, before you go, Jackson, ask Shiri what else she's planning to do for not just Cameroon, but for the rest of the continent. She's so inspiring.
Right. So what else are you planning to do for not just Cameroon, but just showcasing art on the continent?
Yes, so basically my work also depicts you know, I have paintings of the Maasai, Kenya. I have paintings of South Africa, women singing I have paintings from Ghana, you know, showcasing Adinkra symbols. So I actually love to depict and pick up, you know, beautiful, you know, the essence of every country and then put that into painting. So I don't only focus in Cameroon, I love to capture all of it. And in fact, I have a fabric that does exactly that. It's a debut thing that I'm doing on the closing of my exhibition on the 7th of September.
What is that?
It's so my closing of my exhibition, I will be having a fashion show, and I've created my own fabric. I'm so excited, which actually embodies symbols from the north, the east, the south, the west, and the central Africa. And all of these symbols are on the fabric, and I'm using that as my fashion show.
Kind of a Pan-African fabric, so to say.
Correct.
Yes. All right, Esther, back to your studio.
Lovely, lovely, Jackson. Thank you very much, Jackson and Shri, for that. Jackson Vunganyi, live for us from downtown Washington, D.C. And that's our show for today. Be sure to watch Africa54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.